Hello, my name is Jason. Today I'm going to be talking about doctors overprescribing medications, the misuse of them, and why it is so important for people to take a stance against this issue. Imagine that you walk into your doctor's office just for a mild ache or pain. You then walk out with a prescription for an opioid narcotic prescription and get told to rest. This happens every day around the world. Most people are unaware of the medications they are being prescribed and feel that they should always just do what their doctors tell them to. Some doctors may be prescribing medications that may not even be needed and that the patient will never even know. It's important to understand why doctors do this, as well as what can happen when these medications are repeatedly misused. The World Health Organization estimates that more than half of all medicines are inappropriately prescribed, dispensed, or sold. This action is known as overprescribing. Additionally, around 50% of patients fail to take their medicines correctly. In my hands, I have a picture of a medicine cabinet full of drugs. This is what many people's cabinets look like due to overprescribing. Overprescribing is defined as prescribing excessive or unnecessary medications. According to the Mayo Clinic, about 70% of Americans take at least one prescription drug. The most overprescribed medications are pain-killing opioids and weight loss medications, such as GLP-1 injections. As an EMT, I receive many calls involving misuse of these prescriptions, including detoxes, overdoses, and even deaths. It is important to know about these overused drugs so you and your loved ones can avoid dangerous situations. As a pharmacy technician, I see people coming in for opioid prescriptions for having a little pain. I also see all of the GLP-1 medications being used for weight loss when the doctor has not even tried an alternative first, such as metformin, which hardly ever goes out of stock or on back order, compared to that of GLP-1s, which go on back order many of times. Additionally, the side effects for GLP-1s can be intense and turn into an issue where your body is dependent on the medication, and if it does not get it, it can cause intense withdrawal-like symptoms. Now, you might be thinking, what are the causes of overprescribing? One of the most prominent causes directly relates to the pharmaceutical companies. These companies have many ways they influence the healthcare system. These companies often provide financial incentives for the doctors, including meals and continued education. According to the University of California, San Francisco, researchers found that physicians who receive just one meal for free from the pharmaceutical manufacturers, costing on average less than $20, were up to 2 times as likely to prescribe the promoted brand name drugs as they received the free meals from the pharmaceutical companies. These doctors are being essentially bribed by the pharmaceutical companies. It's important to understand that the people from the pharmaceutical companies that come to the office to sell their medications have little to no medical knowledge of what they're even selling. These people are just sales representatives, just like car dealerships, and they have no knowledge of what these medications actually do. The companies are known to be large supporters for funding medical schools. This also causes medical schools to favor using certain branded name medications over others that may be more beneficial to the patient's health, such as something as simple as nutritional counseling. When doctors are unsure about a patient's condition, they tend to prescribe temporary solution drugs such as the painkillers or even antibiotics, depending on the patient's symptoms. Short appointment times can also make it harder for doctors to properly diagnose their patients. Improper follow-up care also makes it difficult to change medications prescribed. There's also a gap in non-drug therapies available to patients due to insurance coverage issues. Along with this, there is a large stigma against mental health issues, leading to patients to choose medications over therapy. This alone led to a rise of antidepressants over the last few years. Another thing that contributes to the overprescribing of medications is patient expectations, specifically involving direct-to-consumer advertising. This is when there are digital advertisements such as those on the TV. An example of this is the commercials for Ozempic. Many patients see this as an easy fix because the commercials only show the positive sides of these medications. These types of advertisements can lead the patient to ask for these medications without doing proper research beforehand. Real-world examples of overprescribing include the opioid epidemic in the United States, which was initially caused by the pharmaceutical companies saying that the drug OxyContin was safe and non-addictive to use for pain. This led to the doctors to prescribing this medication over the alternative treatments such as physical therapy or a non-controlled narcotic. which cause the opioid epidemic. Chronic use of these opioids can lead to physical dependency. This is where patients can build a tolerance for the medication and will experience withdrawals without the drug. This results in a need to increase the dosage, which can lead to drug abuse. These drugs, when mixed with other drugs or alcohol, may lead to an overdose. According to the World Health Organization, in 2019 alone, 600,000 deaths were caused only by drug use. The other most common overprescribed medications, GLP-1s, there are many consequences to these medications, including gastrointestinal side effects, short-term use side effects, such as nausea, vomiting, and loss of appetite, and even more importantly, there are long-term side effects that people don't realize as well, and they can lead to severe dehydration and malnutrition. Research has also shown that there has been a link between GLP-1 medications and cancer. The misuse of these medications has found that the treatment for type 2 diabetes without these medications has led to shortages in the medications that those patients specifically needed. The drugs have also been linked to eating disorders such as anorexia or bulimia. Taking these medications for weight loss is also considered a risk due to the unknown long-term effects to the cardiovascular system. Lastly, it is important to understand that overprescribing medications such as antibiotics can lead to resistance. With antibiotics, this is known as antibiotic resistance. This can cause an issue when trying to treat an active infection in the body because the medications prescribed will not work. It is estimated that 1.7 million people worldwide die from antibiotic resistance a year. Now you might be thinking, what can be done about this? In order to reduce overprescribing, there needs to be many changes in the healthcare system. Healthcare providers should receive better training, as well as ongoing education for prescribing medication and non-drug treatment options. The monitoring system known as PMAP should also improve the system to flag early or excessive prescriptions, and if the doctors prescribe the medications too early or too excessive, they should be reprimanded. There should also be a policy in place that mandates a minimum amount of time that an appointment should be to ensure that the patient is discussing all possible treatment options with the doctor. Patients should also be encouraged to ask questions and seek a second opinion if they wish. It is important that medical schools show the importance of alternative treatments and focus on how the healthcare system should prioritize the well-being of a patient over the profit from pharmaceutical companies. Overprescribing medications has led to many issues worldwide, such as shortages in medications, the opioid epidemic, and even antibiotic resistance. These issues can be extremely dangerous and can even lead to death. This may seem like it would not happen to you, but without the proper knowledge of these prescriptions, it can happen to anyone at any time. It is time that we all take a stance on this issue and help stop the misuse of these medications. It is also time that we take a stance against the pharmaceutical companies whose only aim is to make money, to matter the consequences. Thank you.